TummyTucks, to drain or not to drain? That is the question. Whenever I talk to patients about tummy tucks, the issue of drains always comes up. Patients hate drains, especially when they are coming out of the sensitive pubic area or around the incision line that is always tender after surgery. Are they absolutely necessary? Well, drains are used for two reasons. One is to drain out blood, and the other is to drain out serous fluid. That's that clear fluid that the body produces in response to an injury. The reality is that there's usually very little bleeding after a tummy tuck, since the surgeon spends considerable time coagulating the bleeding points with a cautery. I even had the anesthetist elevate the blood pressure during surgery to mimic the effect of post-operative discomfort on the blood pressure. Any additional bleeding points produced by this maneuver are also coagulated. The bottom line, you usually don't need drains for blood drainage. The second reason for drains is to remove clear serous fluid that results when the skin is lifted off of the muscle. The body naturally removes this via the lymphatics, but these are partially disrupted with surgery. Fortunately, we can preserve many of these lymphatics by leaving a layer of fat on the muscle as we are lifting the skin, something that I always do. Even with this, however, some serous fluid may still form and collect. We call that a seroma, and if it's large, it will need to be drawn off with a needle and syringe after surgery. This aspiration of a seroma may be required several times to eliminate it. So how do we prevent seromas? Well, number one, drains. The drain suctions the seroma fluid off, and the skin then seals itself down to the muscle, allowing removal of the drains by 5 or 6 days after surgery in most cases. The second way, suture the skin down to the muscle at the time of surgery. This method is preferable as it allows us to do the surgery without drains. But is it effective? A paper published in the Aesthetic Surgery Journal this year goes into this topic in detail. The article reviews 597 consecutive cases of tummy tuck in which progressive tension sutures were used to suture the skin down to the muscle. Was it effective? Most definitely yes. There was only one seroma in the 597 cases. Now, what is a progressive tension suture? Well, it describes how the skin is sutured down to the muscle. Instead of the skin, it's actually a thin layer of material called the superficial fascia that's located several millimeters below the skin surface that's engaged by the suture. This fascia is sutured to the muscle fascia located underneath it. And as one sutures the superficial fascia to the muscle fascia, one pulls the skin downward, putting a bit of tension on it. The next suture pulls the skin down a bit further, hence the name progressive tension. At the end of the suturing process, one has effectively pulled the abdominal skin downward so that the abdominal skin and the pubic skin edges come together easily, minimizing tension on the scar and thus minimizing spreading of the scar. This lesser amount of tension also increases the blood flow at the skin edge, which maximizes the excellence of healing. The result is theoretically a better looking scar. We've also avoided drains. A winner. I've been using the progressive tension suture technique and am a believer. I recently had occasion to speak with Dr. Harlan Pollack, the author of the paper I referred to. He continues to use the technique and is delighted with the results. More and more plastic surgeons are also recognizing the advantages of this technique. The additional 15 minutes of surgical time required is well worth it in exchange for a much easier recovery for the patient and a potentially better scar. This is Dr. George Sanders.